The views and opinions expressed on the advice line are not necessarily those of the station, the sponsor, or your host. Advice is provided for informational purposes only. Advice line appearances are paid for by the participant.
And good afternoon. I'm Bob Lewis. Welcome once again to our continuing series of interviews with the doctors and experts from the Summa Health system. This program is sponsored by Summa Health. April is going to be Alcohol Awareness Month once again, a time to raise awareness about alcohol and other substance abuse disorders and all the serious health consequences associated. The program today, we're welcoming Dr. Ali Zawel, who's a psychiatrist specializing in addiction medicine at Summa Health, to tell us about what we should know about substance use disorder, including some of the signs, symptoms, the treatment options, and how to support someone who's struggling with this disorder. Dr. Zawel, thank you for joining us on the program.
Good afternoon. Thanks for having me, Bob.
So, first of all, tell us about how we define substance use disorder.
All right. Substance use disorder is a treatable mental condition. In plain terms, it's when someone keeps using alcohol or other drugs, any other substances, even though it's causing a lot of problems at home, at work, in a relationship, or with their own health. The repeated substance use can actually change how the brain works. Those changes don't just go away when you get high or get the pleasure, and after that it wears off. No, it continues and stick around and start building up tolerance, and you need more substance to get the same effect. And even if you try to stop them after that, you start experiencing withdrawal, and it already did the changes in your brain. So over time, basically, excessive consumption can lead to development of chronic diseases, not just like physical, but it also can be mental and serious issues that can affect the quality of your life. And as I mentioned, like physical and mental health are affected tremendously with that.
Now, what are some of the risks that make us liable for a substance use disorder?
There are a lot of risks. Like we can start with the age-related risks. Like in young adults, brain development is still in progress. Adult identities are like forming transition, such as in college. Exposed to these groups causes increase of the risk for substance use. According to 2022 National Survey by Substance Abuse and Mental Health Service Administration, about 50% of young adults aged between 18 and 25 drank alcohol in the past month. And out of those, 60% already had the binge drinking in the past month. Then we come with the midlife adults. They start having stresses due to parenthood, employment, marriage. So it can be those factors can attribute to their increased drinking and substance use. And then we get to the older adults, with changes in the body. They start getting like pain issues, arthritis, and they start using drugs or alcohol to self-medicate. And it becomes a vicious cycle. It can cause injuries and falls, memory problems. And also there is one of the things that the people they are not aware of, that genetic risks. There are genetics that are involved in substance use, genes influence risk by affecting various biological processes in mental states and traits. Examples include psychological response to alcohol. Not everybody that drinks responds the same way to alcohol or substance. And there's also the mental health, which part of it is genetic, part of it is the way the people are brought up. So it can increase the risk for substance use. Like they also try to self-medicate for depression and anxiety, PTSD, and that will include exposure to trauma and other stressors.
Is there such a thing as an addictive personality?
There is, definitely. As I said, people with addiction, they have a different makeup of their brain than other people. I'll give you a baseline example. If a normal person sees the sun set and he says wow, it feels so good, because they have enough serotonin in their brain already, and that can cause happiness. Well, somebody with addiction, they don't produce the same amount of of chemical transmitters. So when they see the same sunset that the other person see, they're not going to be as happy. So they need that boost from the outside substances to feel normal, not to feel high. So yes, there is a difference between somebody with addiction disease and somebody that's normal.
Now, what are some of the signs? How can we tell if someone or ourselves have a substance addiction?
Well, there are some common signs and symptoms you can watch for, like failing to fulfill obligation at home, work, or school. There can be like sudden weird financial issues that were not there before, relationship problems, withdrawal from the loved one. Remember, like people with addiction, their brain tries to trick them that they want to be by themselves so they can keep using. So withdrawal from loved ones is a big thing. Loss of interest in favorite activities, change in eating or sleeping habits or patterns, memory lapses, poor concentration, worsening depression and anxiety. Those are few things that you can look at to start suspecting someone has substance use disorder.
But are there people that can be in the throes of alcoholism, for example, or substance abuse that have no outward symptoms of it? I mean, they function normally, they do their jobs. You can't tell if they're high or drunk, but they're drinking a fifth of gin a day or taking drugs of some sort. Is there something about those people that makes it particularly hard to find out if they're really battling an addiction?
Well, I mean, even if they're like people say functional alcoholic, I mean, with this amount of drinking, eventually is gonna catch up with their health. And if they know that it's affecting their health and they're still drinking, that's by itself is one of the criteria for substance use disorder. We see a lot of people in the hospital. They came in not for alcohol issues. They came up, for example, with atrial fibrillation. But one of the most common causes of atrial fibrillation, which is irregular heartbeat that can lead to strokes, is alcohol consumption, especially on weekends, binge, even if they don't drink during the week. But they all of a sudden, it's a weekend, let's relax and have fun. One of the causes of this irregular heart rate that can lead to strokes and a lot of health issues is this kind of drinking. So eventually it's going to catch up with them.
What are some of the other health issues that can come about from both alcohol abuse or other kinds of substance abuse?
Well, I mean, if you're going to talk about just alcohol by itself, alcohol basically, if you're drinking excessively, it stocks into each cell of the body. So if I'm going to go like with the brain, it can cause memory issues. The heart can cause irregular heartbeat, congestive heart failure. Liver, it can cause liver failure. It affects basically every bone in your body. It can cause, it even affects the bones. Like one of the common side effects of alcohol for people that above 60 is something called a vascular necrosis of their hip bone. So all of a sudden, he thinks there's nothing wrong with him, but all of a sudden he cannot walk or he's limping. He goes get an MRI, and he finds that his hip joint is gone. So basically, it affects every cell in your body differently. Like the bone, you can have bone issue. The heart, you can have heart issue. The brain, you can have brain issue. And brain, mainly, it causes shrinking of the brain. So if you have memory issues, it's going to make it worse. Of course, strokes is going to make it worse, and it has to affect your decision making because it prevents your frontal lobe from controlling your brain to do the executive function it's supposed to be doing. So you do bad decisions.
Now, again, we're talking a lot about alcohol awareness because that's what April is. But there's a lot of controversy now, a lot of different studies coming out and different opinions about if there is any safe amount of alcohol that one could have, if at all. Well, what is the current idea about whether alcohol is safe at all, even in modest quantities?
Well, if you're going to talk about alcohol, there is nothing safe about alcohol. As I said, there are people that can handle it, but there are also people with addiction disorder that they don't know that they have addiction disease disorder. So in this case, if you think it starts affecting your life, then even one drink is not good for you. You can, if it starts affecting your relationship with your spouse, your studying, your work, you need to know that one drink is not good for you. It's as bad as 10 drinks. So some people they can handle it, and some people they can't.
So let's talk about again how to help somebody who is suffering from alcohol or even other types of addiction. Again, as a relative or a loved one or a friend of somebody who is an alcoholic or addicted to a substance, what kind of support can we provide for them that can help them?
Well, you have to talk to them first. Like, find a way to talk with a loved one about addiction is never easy. So start by setting aside time to talk when you're both free with no interruptions or distractions. Some tips to help to start the conversation: emphasize your concern about the person's health and well-being. You can offer support without judgment, blaming, or arguing. You have to understand it's disease, so don't just blame them. It's like you're blaming a diabetic person for having high sugar, So stick to the facts about how treatment can help. Ensure that they don't have to do it alone. Ask open-ended questions, and then listen without interruption. Acknowledge their feelings. Show respect to their point of view. Focus on what loved ones should do instead of not to do. And also tell them there is professional help is available right now without being judged. If a loved one is struggling with addiction, it may be difficult to know where to turn for help. The good news, there are available programs all over the country that can offer help that they need. For example, Summa Health, where I work, we can assist your loved ones from the very first step of recovery, keep maintaining understanding that every person experiences is unique. Summa treatment plans is tailored to your situation and your individual needs for the best outcomes. We offer a first aid program in the ER, where basically it's open it's emergency room, so it's open 24/7. So if you're having the withdrawal issues, if you're having cravings, all you have to do is just go to one of the ERs for Summa Health, like in Akron, Barberton, Greene, and Wadsworth. The emergency room, as I said, is open 24/7. At the very first visit, providers we treat all the withdrawal symptoms, ease craving, and provide on-site care coordination to ensure patients don't leave our hospital without a plan. This program provides care and assistance for patients in needs for addiction and any addiction, like the new ones that came out, like kratom. I'm sure you heard about kratom. It's a big thing now. And of course, the alcohol, benzodiazepines, methamphetamine, cocaine, even marijuana, and smoking too. Then after this evaluation, we have a full detox unit that has specialized psychiatrists, specialized social workers, and of course, specialized addiction medicine doctor, specialized nurse just for addiction medicine. And to know about how we are very unique about this detox unit, we have been the first detox unit in United States since 1939. We built this detox unit with Sister Ignatia and Dr. Bob Smith, who is a co-founder of Alcoholic Anonymous. So we've been dealing with this problem for more than, I'm not very good at math, but 1939 till now, I would say at least close to 100.
Almost 90 years or more, almost 90 years.
Oh yeah. So that's. So we are very experienced about that. Our detox unit, as I said, we're so specialized. We approach the patient through 60 degrees from all the angles. As I said, we have the social worker that's just specialized for that, nurses, and we have meetings and inside of the unit. And it's a very nice unit. It's like private rooms, 2 large areas. We have a lot of activities. So the patient, they don't feel that they're judged. They feel that they are part of this community. We let them we let them get really involved in their treatment by offering them a lot of alternatives. And before they leave, we got a plan between them, their loved ones, the social worker, just to make sure that the treatment process stays on. And this is include offering them something called intensive outpatient therapy after they're done, which is it explains itself. It's like 3 hours a day, 3 times a week for 15 to 20 sessions. It's basically cognitive therapy. So plus that, we also have a unit for dual diagnosis. So definition, they have dual diagnosis, like they have psych illnesses, and on top of that, they have addiction problems. So we have the unit specialized for that. So we cover all type of addictive disease, whether it's mainly caused by mental health or other issues. Summa Health program also supports abstinence in the form of either complete abstinence or something called harm reduction treatment program. Like in the past, if let's give an example of opioid use disorder. In the past, if the patient starts relapsing on other substances, we would consider that this is like a red line. We cannot cross that. You cannot use other medications while we're treating you for, other substance while we're treating you for opioid use disorder. However, recently, and when I say recently, it's like the last few years, I would use something called harm reduction, which means, yes, I understand the patient keep relapsing on other substances, but I would still keep treating him in order to prevent a major catastrophe like overdose, that kind of stuff. This is called harm reduction. So we use for that something called medication-assisted treatment. So Summa Health offers a broad spectrum of specialized addiction services, including this medication-assisted treatment, which is approved medications that helps with cravings, help with withdrawals, so the patient does not need to keep using. So we use this medication-assisted treatment, including, I'm sure a lot of people heard about Suboxone, which is buprenorphine, and it comes in forms which is oral, sublingual, or injectable. And we also have the naltrexone, which also come in oral forms and the injectable forms like Vivitrol to help them with cravings. We don't stop only at that. We keep following up to make sure that giving this medication has taken care of the cravings. If not, we can add medication. We add the IOP, which I mentioned prior to that. And also, we try to dig deeper in the root of the problem. If it's a mental health problem, we get a psychiatrist that is specialized in dual diagnosis to make sure that the problem with their mental health is not going to continue to be a trigger for relapsing. So basically we offer the 360-degree care for those patients in our facilities.
Once again, we're talking to Dr. Ali Zawel, who is a specialist in addiction medicine at Summa Health, a psychiatrist there, about substance abuse, and again, especially alcohol abuse. This is Alcohol Awareness Month coming up in April, and alcohol is probably the most commonly abused type of a drug out there, although we have, again, many other drugs that are vying for second place, like marijuana, even cocaine, and prescription drugs, too. Would you still say, Doctor, that alcohol is still the main drug of abuse in this country?
Yes, alcohol is basically due to the availability. You can like order it online and it's brought to your house. So the availability is the issue. Plus, people look at alcohol use disorder different than other substance use disorder. So in some communities, it's acceptable to have alcohol use disorder, but it's not acceptable to have other substance use disorder, which we try to explain to people that alcohol is drug. It is. It affects the brain exactly the same way that other drugs affect the brain. But you're right. Alcohol is still number one abused substance in the United States.
Yeah,
Aside of cigarettes, of course, cigarettes too, nicotine. But we're talking about the one that have massive effect on people's life.
let's talk about again when someone is becoming, before they can make that decision to enter some kind of treatment. You often hear people say, "Well, sometimes the alcoholic has to hit rock bottom before they might turn around." And again, I've known a friend of mine that one day woke up in a jail cell in Massachusetts, had no idea how he got there. He had blanked out for the last 2 weeks, and this finally got him to seek treatment. Does it have to be that way? Does it have to be some kind of terrible crisis before an alcoholic seeks treatment? Or could we intervene somehow and get them to treatment before that ultimate tragedy has to happen?
Well, the issue, Bob, is that the rock bottom is different from one person to other. So some people, the rock bottom is if they get into accident or hurt someone else during an accident. Some of them, the rock bottom is if they use intravenous drugs and they will end up with amputated limb. But other people, the rock bottom is basically if they go late to work. So we cannot judge the rock bottom from one person to one person because people are different. That's why alcohol or substance use disorder is the recovery is basically 20% in some categories, but when we do the exact same study to see for professionals, the recovery is 80%. Because if you think about the rock bottom is different. So I would instead of why wait till they hit the rock bottom and the damage is really hard to fix. If you feel or your loved ones feel that there is an issue with your substance use alcohol intake, try to get into the core of the problem before it becomes worse. But again, unless the person with substance use disorder unless they are ready, there's nothing you can do to convince them that it's time to start treatment.
Now, recovery from abuse, it is a journey. It's an ongoing journey. Again, you talk to many alcoholics, and they will tell you it's a day by day, literally. Of course, it is not uncommon for someone to have a relapse, to have a slide back from time to time, and there's a lot of stigma around that when that happens to someone. Can you tell us about that and how people can again recover from those relapses and get the support that they need?
Yeah, I mean, but first thing, remember that recovery is a journey. Okay, people do not become addicts overnight. It happens over the course of many years, and so does the recovery process. Relapse is often part of the recovery journey for patients. People usually mentally relapse days prior to physical relapse, so they should be aware of that problem. To explain this in an easy way, you're still abstinent, but your brain starts playing a trick on you. That's why you shouldn't be alone. So it will say, well, I mean, my loved one will be outside of the house on a trip in the next 3 days. I can start planning a small party for myself, drink a little bit. This is mental relapse. You haven't relapsed, you haven't taken alcohol yet or a substance yet, but your brain already relapsed. So you have to be aware of those kind of tricks your brain playing. That's why you have to get an addictionologist and a specialized person to help you throughout that journey, or at least the first year and a half, till your brain chemical neurotransmitters get back to the normal levels and the neurotransmitter, and your brain is rewired to think logic like you used to do before.
Now, once somebody is in recovery, they completed treatment, they're now in that recovery journey. As loved ones or again as friends, what are some tips of how we can best support them in their recovery? And are there some things that we should do, and maybe some things that we shouldn't do to help that person?
Okay, you have to continue follow up with a medical professional. Keep meetings as often as needed. We recommend like at least monthly visit with a specialist, or like if the patient becomes stable, we can make it every 3 months. But at least for the first 2 years, that's when your brain rewires and you can start thinking logic. And I always tell the patient that you're going to start thinking clear and clear for at least like after 6 months, you're going to be like, wow, I'm thinking so clear. I didn't know I can think that clear. I tell them, wait for another 3 months, and after 3 months, they say like, wow, yeah. I mean, we didn't think that we can think clearer than that. And I always tell them like, you will get a little bit embarrassed of the things that you used to do in the past. Don't take this as a negative sign. This is a positive sign because now you're thinking logic. So I tell them, if you think embarrassed of behavior in the past, this is a very good sign that your brain is rewiring and you start thinking right. You can join support groups such as AA. Do not neglect your mental health because, as I said in the past, medical people try to treat their depression and anxiety by using substances. So do not self-medicate. If you have a trigger in the form of mental health, get this treated. And remember, you cannot beat this alone. You have a lot of support in the community nowadays, so always try to take advantage of this support.
And is it also possibly wise to find or avoid certain friends or certain situations that you were in before that lend itself to the alcohol abuse that maybe you should avoid as you're recovering? And again, not hang out with that particular set of friends who are still probably drinking or doing what they were doing. Should you find like new acquaintances or again avoid those situations of those people?
Oh yeah, that's. I mean, like we always says, like you have to avoid all the triggers that can cause relapse. So one of those triggers is friends that drinks because you are still early in recovery and you cannot handle cravings on your own or this kind of triggers. That's why we we give those medications to help with craving. But with certain substances, I tell them it doesn't matter how much medication I'm giving you. If you see substances or drugs in early recovery, you cannot resist because your brain is still trying to rewire. So we tell them to avoid that. We have meetings, and we even like the Al-Anon counsel their loved ones how to be supportive, not to drink around them. Situations, we try to tell them to avoid any kind of situations that that can cause the relapse. But yeah, in the beginning, that's why we keep a very close follow up with them till they realize that they can handle those kind of stressors or triggers on their own.
Doctor, as well, if somebody's listening right now, and again, whether they themselves are possibly in the throes of addiction or alcohol abuse, or a loved one is, what could you say to them to get them to seek treatment and tell them that there's hope out there for them?
Well, I just want to let them know they are not alone. Help is readily available. Know the signs of your substance use disorder and understand its harmful impact on your health and on your emotions. And it's not going to just affect you; it's going to affect your loved one. But know that the treatment is available 24/7. Just go to the emergency department at Summa Health. We'll offer help right away. We'll put a plan for you. We have addiction care coordinator 24/7. Like 4 o'clock in the morning. We have, and they consult with us, whoever the addiction medicine physician on call. We do not let you go into this trip alone. So seek help, seek help, seek help.
Again, to find out more about the Summa Health Addiction Medicine Program, you can call them toll free at 866 506 4917, 866 506 4917, or go to the website summahealth.org/addiction, summahealth.org/addiction. Again, Summa Health, Akron has been with a leader in the country in alcohol awareness and alcohol abuse treatment, and Summa Health was there with the beginning, as they say, with Dr. Bob and the like back in 1939 when they founded Alcoholics Anonymous right here in downtown Akron. So they've been around for a long time. They have a lot of experience in this area, and again, it's something that every single generation that comes by has to deal with because it's something that's always in our society and is always going to be a problem. So whether it's alcohol or other substance abuse, if it's you or somebody else that needs the help, turn to Summa Health. Call them at 866 506 4917 or summahealth.org/addiction for more than 90 years of experience in dealing with these situations as, again, we enter April, Alcohol Awareness Month. Again, Dr. Ali Zawel, thank you for being with us here. He's, again, a psychiatrist and specializing in addiction medicine at Summa Health. So we thank you so much for being on the program today, sir, and we wish you a lot of luck and blessings in the work that you're doing.
Thanks, Bob. Thanks for having me again.
I'm Bob Lewis.